So we are going to learn about understanding your 3 Medicare options today with Russ Swallow. He's already on, so thank you very much, Russ. It seems that there is a lot of confusion as far as what we have. Oh, let me see. I could do that too. All right. There is a lot of confusion as far as our Medicare options. So it's going to be very educational for us to be able to listen to Russ and all he has. So we're very pleased to have him here. I hope everybody's doing well and enjoyed your holidays. Just when we thought we were on that other side of COVID, well, Omicron. So they're telling us February 1st, we should turn a corner. So I think we're all really waiting with bated breath, right? We appreciate you being here, and I'm sure you'll have some great takeaways from Russ's presentation. Again, I'm going to thank you in advance for being patient. I'm manning this by myself. So in case we have any technical difficulties, bear with us. But I think that this presentation will help clarify the options we have to choose from for Medicare when the time comes for ourselves, as well as our clients or our loved ones. So this should be good information. Our lunch and learns are interactive, and there will be Q&A at the end. We'll try to get to as many as possible. I know I do have one question emailed to me already that we'll try to get to. So we'll have Q&A at the end. I'm going to give you a quick campus overview of the JGS Life Care campus. And I want to, Ruth's house, we're going to give a quick tour because that's usually where we hold our lunch and learns in person, the good old days. I'll introduce Russ. Russ will present. We'll have the Q&A. And then, of course, I pick a raffle winner. This month, we're giving away a $25 gift certificate to Randall's Farm and Greenhouse in Ludlow. Of course, my name is Mary Ann Shelb, and I am Director of Business Development here at JGS Life Care. The campus is truly a hidden gem here in Long Meadow. And I'd love to take the opportunity to be able to share this with you. So give me a second, and I'm going to share my screen again. Let me just see if there's anybody in the waiting room. Nobody in the waiting room. Okay. So let me do this. Let me do share. Oh, we got chat. Let me just check these. Okay, we're good. Is anybody having trouble hearing? Everybody can hear me? Are we good? Okay, so all right, because somebody said they were having difficulty. Okay, all right, perfect. I just wanted to make sure. Thank you. Thank you very much. And we're going to do a share screen on my end. Okay. All right, let me just, oh, we got somebody else. Oh, hold on one second. Hold on, so I have to do this and this. Hang on one second. Okay. Oh, I admitted her. Okay, try this again. This is the technical difficulties, so I do appreciate. Try share screen again. I can't admit and share at the same time. So I think they're gonna have to wait for just a minute. All right, so let's actually start with this. Let me know if you guys can see a map of the campus. Do I have a thumbs up? Russ, all right, perfect. So this is our 23-acre campus of JGS Life Care right here in Long Meadow. So we've got a number of entities available to us. We've got the Levitt Family Jewish Home, of course, our 24-hour skilled nursing home, including long-term care, long-term rehab, with secure neighborhoods for those period exit seeking residents that we have. We've got the Sossin Center for Rehabilitation, the first greenhouse model of care in Western Mass, featuring 2 small houses, all private rooms, all private bathrooms with consistent care teams, all in a home-like setting. And if you look at it, we've got basically a pottery barn table in the front. We've got the pendant lights in the back with, quartz countertop, beautiful cabinets. It's like a home that you and I would live in. So, a greenhouse model of care is a little bit different than a regular rehab. And if you've never seen it, I would actually, of course, maybe after COVID, I'd love to be able to tour you and show you what a greenhouse type rehabilitation looks like. We've got Wernick Adult Day Health, which is your loved one safe and cared for in a dynamic setting, promoting social interaction and stimulation while you're able to go to work or run some errands. Spectrum Home Health and Hospice, quality care that comes to you in your own home with personalized plans for each patient because everybody's different. We've got Genesis House, which is a senior independent living with efficiency and one-bedroom apartments located on the campus, which gives the residents there access to our family of services for that full continuum of care. It's like a CCRC, but we don't have that big buy-in at the beginning, which is very nice and a little bit different. That's why we're not considered a CCRC, but we still have a campus of care. And of course, Ruth's house set back away from the main street with a very private and wooded backdrop lies our gorgeous home-like setting for both traditional and memory care residents. So give me a second. I need to stop share for a second and I'm going to do a tour. I've got to admit a couple people, bear with me. And then I'm just going to bring up the tour. Okay. All right, so now I'm going to just make this bigger. We've got a Matterport tour right on our website, which makes it very easy for people to see what we have. So I'm going to just play this. This is the lobby when you first walk into Ruth's house, and it's going to go through the rooms, right? So this is when you first walk in. You've got the dining room right straight ahead of you. The windows in the back overlook a beautiful waterfall. Of course, we had to take it very early in the morning when the residents were not necessarily roaming about. So the windows are dark outside. Library, or we always have a puzzle going on the table. Various community rooms. This one has a fireplace. It's actually now going to go into the country kitchen, which we always have snacks. Of course, right now, everything is kind of individually packaged. This is a sample of a one-bedroom. We're going to actually walk right in. So it really depends on how you're decorating this, but there's standard one bedrooms. There are mid-size as well as large, as well as companion apartments for something that you want a little bit more cozy and some people get lonely at night. You've got your own private bathroom, bedroom. You've got community rooms all over the community to be able to have an extension of that apartment. This is going to be a sample of a large one bedroom. You've got almost like a galley kitchen. Some people put a bistro table in the hallway there, or this one had one in the, they split it, living room, dining room, bedroom. And of course, this one I absolutely love. It's got a walk-in closet, and then it goes right into the bathroom. So they're really good sized apartments. This is our activity room, where we have a life enrichment director like no other. So you'd have to actually ask for our activities calendar to see all that she offers, but it is quite amazing and we get a lot of really good positive comments. Again, we showed a sunroom. We've got exercise rooms. We've got more common space for people to be. And we've got a salon, of course, full service, pedicure, manicure, as well as a movie room. That seems to be a favorite of our residents. So we cater everything to the residents that we have in place, right? This is showing one of the decks. We've got a lot of decks, a lot of patios. Let me see, I can actually stop sharing that. Oh, and I can admit somebody else, okay. But we've got a lot of decks and patios that make it really nice to be able to really enjoy the outdoors. We think it's important to get some fresh air. So we've got decks, patios, front, back. You could watch sunset, you could watch sunrise. So there's a lot of options. So I hope you enjoyed that. One day when we could actually tour in person, I'd love to be able to show you. So please reach out to me personally. But now I'd like to introduce Russ Swallow, certified senior advisor and a licensed insurance advisor as well. People are so confused about their Medicare options. Everyone seems to have a piece of it, but the challenge is wading through all the massive amounts of information and or misinformation so they can make an informed decision. This workshop hopefully will end your confusion. Russ, being a licensed insurance advisor as well, he has both specific as well as extensive knowledge as a health insurance broker that began back in 1970. When you consider his senior related experiences, sole caregiver for his mother for the last 8 years of her life, Russ has dealt with his own personal health challenges, prostate cancer in 2009, the radiation won, the cancer lost, thank God. Quadruple bypass surgery in 2015, cataract surgery in 2016. I'd say that Russ understands senior challenges as he has lived them. So with all that, Russ, I will leave this to you. And if you want to share your screen, you are already set up as co-host. So you are good to go. Welcome.
All right, let me see what I'm looking for here. I think I'm looking for this page here. I think if I call it slideshow here from the beginning. I think that's it. All right, well, growing old ain't for sissies. I'm going to try not to cough. I'm getting over a cold. I've been tested twice for COVID, negative all the way. And I've got my ginger ale to stop the cough. So moving along, I thought we were rid of this guy, but he's back. And I'll hit upon his, the story about you're going to get more in your Social Security check if you call in with your zip code. So what we want to talk about today are three things. We have three basic Medicare options. Obviously, there's a whole bunch of insurance companies and they've got multiple plans, but you have your choice is really staying with original Medicare, which is parts A and B plus a drug plan, or to Medicare Advantage, or to Medicare Supplement plus a drug plan. I like to go into a little history of this. Before July of '66, there was no Medicare. Whoops, how do I shrink this? Okay, the first application was pretty simple. Do you want the insurance, yes or no? It cost a staggering $3 a month. So who got it first? Harry Truman. And his witness was LBJ. There's the signing ceremony. So original Medicare was hospital insurance and medical insurance, and it stayed that way for 40 years. And there was no drug coverage in 2006. So anytime you hear the words original Medicare, you're talking about hospital coverage, which is Part A, or medical coverage, which covers physicians and outpatient, which is Part B. Hospital coverage, if you just have original Medicare, is got pushing close to a $1,600 deductible for each benefit period. It starts when you're admitted and ends 60 days later. It will also pay the first 60 days in a nursing home. And there's some qualifications to get into the nursing home. You have to have had a qualifying hospital stay, but we're not getting into the details. But basically, to get nursing home coverage, you have to have been in the hospital for 3 days as an admitted patient. There's a cost for Part A. If you work paid into the system for 10 or more years, it's free. I've only seen the high end a couple of times, and that's when the kids brought mom and pop over from the old country, and mom and pop hadn't paid into the system. Part B, you can see what it covers there. Medicare pays 80%. You're going to pay 20%. Again, if you only have original Medicare. It's got to be medically necessary services, and there's preventive stuff like flu shots. And it covers doctors, outpatients, ambulance, and DME. Most of us know what that is, but my oldest son has sleep apnea. He wears a CPAP. That's called DME. And some of my friends have suggested I get a frontal lobotomy, but I'm not going to listen to them, so I can go see a shrink. If you don't sign up for Part B when you're first eligible, you could get hit with a penalty later, unless you've been covered by a group health plan in the interim. The Part B cost is based on your income. It starts out for 2022 at $170 a month. As your income goes up, the amount you pay goes up. Now, this year we had the biggest increase in Part B costs, and there's some work being done to push that back. And the big reason for Part B is that there's a new drug out for Alzheimer's. The cost was $56,000 a month, a year. And so Medicare had to allow for that in how they calculate the premiums. Subsequently, it was reduced to $28,000 a year, and maybe even further reduced, so it's only available for a limited number of the Alzheimer's community. And we'll all hear about this later if they reduce it, but you rarely hear about the government going back on anything. All right, so I retired last year. I'm not making the big bucks anymore. There's a form I can fill out to get Social Security to reduce the cost basis for what I pay for Part B. It's there's 8 life-changing events. I picked out work stoppage.
Russ,
Yes,
I actually just saw, there was a question, is that gross or net income? I just want to make sure that was answered.
modified adjusted gross income.
Okay, perfect, thank you.
Your adjusted gross income, I think, is on line 11. But the modification is they may add back some tax-free income you had to come out with that number. Don't ask me how to do the calculation. Your attorney would know. I'm sorry. Your accountant would know, but it's your modified adjusted gross income is the number they use.
Okay, great, thank you.
So that's original Medicare, Part A and Part B. Have you guys ever met a retiree dropout? It lasted 3 weeks. And then I started thinking, 10,000 a day reach age 65 in this country, 210 in Massachusetts, that's 75,000 a year, and they all need help with Medicare. I'm a certified senior advisor, a licensed insurance advisor. I had been a health insurance broker for 40 plus years. Actually, it's 50. I was the sole caregiver for my mother for the last 8 years of her life. And as Mary Ann pointed out, I've had a couple of bouts with prostate cancer. I tell folks I discovered a cure for indigestion 7 years ago. I thought it was indigestion, but the cure was a quadruple bypass. And about 5 years ago, I didn't want to drive at night. The glare was too much, so I had cataract surgery. And I lucked out. That picture you see there is the cover of a textbook on how to do cataract surgery that most of the medical schools use. And the physician that wrote that was the one that did my cataract. So I think I know what this stuff is about. Now, the folks I want to reach, or is somebody about to be 65, over 65, still working, confused about Medicare. A lot of people are dealing with aging parent issues. We hear about the sandwich generation. That's where the caregiver is raising their own kids and looking out for mom and pop. And I had a new one dumped on me a couple of weeks ago called the club sandwich generation. That's where that caregiver is looking out for the initial 2, but the grandparents on top, and veterans that have VA health care. We're going to help you understand it. There's a lot of moving parts. So there's enough people in here, I think, that would like to know how and when you enroll, what if you're still working, and going into the basics. So when we talk about enrolling, we're talking about enrolling in original Medicare, Part A and B. You can get it before 65 if you've got some health challenges. I mean, real health challenges. I'm dealing with a person now who has MS. She's 59 years old. But the sign up is through Social Security. You can do it online or by phone, or you can visit your local Social Security office. And what I like to say with tongue in cheek, in order to qualify to get a job at the Social Security office, you've had to flunk out the customer service training at the registry. But that's not really fair. They've got good people in there. The challenge is, don't go there with a walk-in. Excuse me. You want to go there before it opens or go there with an appointment. Now, when you first sign up, you can do it 3 months before you reach 65, the month you reach 65, or 3 months after. And that little red, white, and blue card there, that's the ticket of admission you need to get any of the other supplemental plans. And as I say at the bottom, if you're still working and covered by a group health plan, don't sign up for Part B now, because you'll be signing up for coverage you already have through your employer. Yeah, that's enough for that one. There's the penalty if you don't sign up for Part B when you're first eligible. How do you avoid the penalty? Sign up or be covered by a group health plan. Oh, what if I'm still working? So you work another 4 or 5 years and then you decide to retire. Now you have to sign up. There's 2 forms to use. I've got these. I can email them to people if they need them. But you have to apply then for Medicare Part B. And then there's a form that your employer has to fill out, part of saying that, or attesting to the fact that you've had group health coverage since you were 65. Now, if you miss out on that initial sign-up period, then you weren't covered by an employer plan. There's a general enrollment period in January, February, and March. But the coverage doesn't start until July 1st. Then there's special enrollment period.
Russ, while you're drinking your ginger ale, I have a question.
Fire away.
Somebody's asking if they can get the working still forms emailed to them. Is that something that was part of your handout?
No, but anything I'm mentioning here, any kind of forms, I can email people. And at the handout thing or at the end of this, you can, my email and address and stuff is there, and you can reach me. I also have a radio program on Wednesdays from 1 to 2. And if people want to get in touch with me, I just say, Google Russ Swallow, RUSS. My last name is Swallow. And the first thing you'll see on your screen will be my name and my company name. And from there, you can reach me. Or you can call me at 508-831-0805. That's 508-831-0805. I'm available 24/7, including weekends. But if you call me at 3 o'clock in the morning, I might not pick up the phone.
Russ, for folks that are reaching out to you, do you have a fee for your service?
Yeah, I just need the winning numbers, the Mega Millions or Powerball. Now, I don't charge a fee. Here's what happens. 95% of the time, when people are looking for Medicare information, they're also looking for information on how to pick the plan that fits them the best. I'm a broker for every Medicare insurance company in the state except one. And if I enroll them in a plan, I get paid a commission by the insurance company. Now, I also, even if I don't enroll them in the plan, my marketing thoughts are at least I've made a friend. So the next time they're talking to somebody about Medicare that has questions, they say, I got a guy, and the guy is me. So all of my business comes from referrals. So the basics. Well, we talked about hospital, that's called Part A under Medicare. Doctors and outpatients is Part B, drugs is Part D. So original Medicare, we've already talked about. Part A is free for most people. Part B has a monthly premium based on income. That's government insurance. It's got a hospital deductible, 20% copay on medical and outpatient, and there's no drug coverage. Because remember back to the initial slide or slides, Medicare started in 1966 and there was no drug coverage until 2006. So the drug coverage of private insurers, there's 27 plans in Massachusetts. Now, these plans are not like that you've been used to from an employer. There are 4 stages to a Medicare drug plan. There's a deductible, there's an initial coverage stage, there's a coverage gap that used to be referred to as the donut hole, which is gone in this catastrophic coverage. Don't try to figure this out for yourself. The Medicare.gov website does it for you. You enter your medications, or we'll do it for you, and you'll end up with a list of all 27 plans, starting from the lowest price to the highest. That's what it looks like on the website. The arrow is pointing here to drug plans. Then we'll click here without logging in. And that's how you get a list of all the drug plans. Now, there's 2 ways you can get drug coverage. One is a standalone plan. That is if you had Medicare A and B, or a Medigap, which we're going to cover in a few more slides. And either of those requires either A or B or both. Or you can get it included with a Medicare Advantage plan, which requires both A and B. There's a cost for Part D. At the low end, whatever your plan premium is, that's the cost. But if you make more money, that gets paid directly to Medicare. And again, I didn't point out the first time, but that's modified adjusted gross, which is line 11 plus add back of certain deductions. Drugs can be very costly for cancer patients. Now, there's 2 types of drug coverage. There's a regular drug coverage that we're all used to having, but there's a Part B drug, which is paid by Medicare Part B. Those are the real expensive chemotherapy drugs. And the person I'm working with that has MS, she takes one drug by infusion, and that's very expensive. So Part B will pay that. And you'll pay 20%. Or if you had the Medigap plan, Medicare pays 20, the insurer pays 20, you pay 0. The plan costs more, but we'll get into that. And one of the things we're not going to do, I cannot discuss specific insurance companies and how much their premiums are, because this Medicare stuff is highly regulated by CMS. That's the Center for Medicare and Medicaid Services. And if I'm making a presentation, there's 2 kinds. There's an educational presentation, which is this one, or there's a marketing one. And if it's a marketing plan, every single slide I have to have on here is approved, has to be approved by Medicare. I don't want to go there. So I don't break any of their rules and turn what is a really an educational program into a marketing program. And if you're taking the drugs at home with a Part D plan, remember there's 4 stages, 1, 2, 3, 4. The 4th stage is the catastrophic stage, where you pay 5% of the total cost. And it's only 5%, but if you got 20,000 drugs, it's going to cost you $1,000 a month. Now, one of the things I try to do to help people, I don't know if anybody's heard about goodrx.com. Well, when I had my cataract surgery, I had 3 different types of eye drops. Eye drop 1 cost $12. Eye drop 2 was $17. Eye drop 3 was $84. $84 falls into the NW category. And I get a little more aggressive in that description if I'm with my friends. Or I'll send somebody to a Canadian pharmacy. There's a website called CIPA, C-I-P-A. It's the Canadian International Pharmacy Association. They've got 68 pharmacy members that adhere to a high standard of ethics. And you just order it through the mail like you do here. Now, I lived in Southern California from 1965 to 1985. And my best friend out there was a physician, a family practice guy. Now, Linda and I were out there in September. The first day out there, I looked Barry up. We had lunch. I hadn't seen him for 40 years. He looked old. He had gray hair. He had wrinkles. But he was still the same Barry that I knew way back when. And he asked me what I was doing, and I was told him what I did, what I just covered for prescriptions using Canadian pharmacies. Now, Barry's from Canada. He's from Edmonton, Alberta, came down here in 1970. And he told me, he said, what pharmacy are you using? And I said, ABCDFG. And he says, that's the same one he sends his patients to. So, you know, if you get hit with an expensive drug, we'll try to find a better way to buy it. There's an extra help program based on income. A lot of the manufacturers have prescription assistant programs, and you can buy a lump sum cancer insurance policy, and some people can set up a reverse mortgage on your house. Don't use a dime of it, but have an instant credit application so you can draw down to pay for, you know, any expenses. And there's a life settlement approach where you can sell part of your life insurance policy for cash while still retaining a reduced benefit. So it's just not, here's the cost, that's it. Well, there's other options. Maybe some of these would fit you, maybe it wouldn't, but at least they're there. Now, Medicare Advantage plans, Part C. These are private insurers having contracts with Medicare. And there's 0 premium options. Now, let me explain how you get there. Let's say I'm me, Russ Swallow is Medicare. I've got essentially 3%, to be exact, 2.9%, but 3% of the entire payroll coming into me every month. It's going straight to me because I'm Medicare. Then all the people with Part B, they're paying in whatever their premiums are. That's all coming to me. So I say, gee, this is great. And then I start thinking about the liability I've got. I gotta pay for up to 90 days if somebody's in the hospital. And all the other benefits that are provided by Parts A and B. So I say to myself, hey, maybe I can get a private insurer to take over this liability. So I cut a deal with them. They provide a Medicare Advantage plan. They're contracted through Medicare. They have to provide all the basic benefits that Medicare requires. And for that, well, they don't do it for free. I'm going to give them at least $1,000 a month for everyone they have insured. So the Medicare insurers, the private insurers, they want all the 65-year-old kids who are in great health. So they're making money hand over fist. And then fast forward that 15 or 20 years, now they're 80 or 85, and they're starting to pay out more, but that's how an insurance pool works. So that's how you can have a zero premium. The companies are being subsidized by Medicaid, I'm sorry, Medicare, and Medicare gets their money through payroll deductions and monthly Part B premiums. What did I do? I don't hit the wrong thing there. Okay, what did I do? Come on, swallow. Get your act back. Share screen again. Okay.
Are you still looking to share?
Yeah, I hit something with my thumb and I lost the thing.
Right at the bottom, you could actually just press share screen again. You should get right back.
I did. That's what I got this other thing here. So share screen.
Mhm.
That's not the one I want.
It should give you, like, if you want to do like one or two, if you have more than one screen.
No, but I can't seem to get it. I know what the hell I did wrong here. I don't want to share any of those. That's not what I want.
You could minimize all that if you wanted to, and then maybe what you want to share is behind it. Just try minimizing that maybe.
Here's my mouse fell asleep.
Oh no. This is the technical difficulty I was telling you about, folks.
Yeah.
So bear with us. This is what happens on a Zoom call. We love the technology when it works, and when it doesn't, it's frustrating, but bear with us, please.
I don't know how that thing fell asleep, but let's see here. I pop it open. It's got a new battery in it, so that should work.
The mouse did just work. So it is, your cursor is moving. So try minimizing that.
I don't see any infrared on the bottom of this, so I don't think it's moving.
The little cursor was moving a second ago.
Well, I'll try it again here with that. I'll take that off there. I'll put that back in there again.
There you go. It just moved again.
Yeah, all right. Okay, so now I don't know what all this other stuff is here. I don't need all of that. So let's see.
Minimize it or exit out, right?
Yeah. I don't need that.
The little line on the, or yeah, that'll work. Perfect.
And I don't want that. I don't know what this is here. I didn't have that on there. But if I say you're screen sharing.
So did you send me the PowerPoint?
I don't know what I did here because it's not, if I say stop share.
Let me see if I have any of your slides.
Oh. Let me hit new share and see what happens here.
There's your PowerPoint.
It's not the right one though. Why isn't this working?
Yeah, I'm not sure if you actually sent it to me, right? Because you were going to run your own. I don't know if I have those slides.
You wouldn't have it. It's on here. So why isn't any of this?
Can you hit that square in the middle of that box between the line and the X?
I
And
don't,
it'll expand it. So
Yeah.
on the
I don't know what you're talking about. I can't get rid of
In the
any
white
of
box. You can X out Norton. Click X on there.
it. It's not working.
Oh, it's not working. Oh, so you're frozen.
It just went,
there you
Okay.
go.
ooh,
There we go.
ooh.
Technical difficulties abound. Hi, Marion, thank you.
You're welcome.
Perfect. There we go.
We went through that. We got to there. We talked about that. I went through that. I went through that. With that.
Almost there.
Got boom, 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 boom. Got into there, hit that. Oh, yeah. Okay. What I just said over here, I was highlighting what happens when you come here. How can Medicare Advantage plans be free? And instead of Medicare doing it, I took all the money in and I pretended I was Medicare. But the payments go directly to Medicare. They then pay a subsidy for each individually insured. And you get all the stuff you'd have under Part A and Part B. And most of these include prescription drug benefits. Now, that money going to there, not only do they provide the benefits, but they also are touting you can get dental, vision, hearing, health clubs, and other stuff. And the reason why the insurance companies are saying they can do that is they're not using all of the subsidy to pay for the health care. So they've got extra to pay for the other stuff. And these plans are HMO and PPO options. And HMO, you're going to need coverage, or you're going to need a referral to see a specialist. Maybe not so with a PPO. And like we just said, they include these other benefits. Now, there's 50 Medicare Advantage plans in Massachusetts. How does somebody pick the one that's the right one for them? Well, we would start out with a list of the physicians you use and a list of your meds. The name of the drug, how many milligrams, how many per day. And invariably, when I get the physician list, at least one of the physician names are spelled wrong. So I have to put on my Inspector Clouseau uniform and do some sleuthing to figure out what they were trying to say. And it's the same thing with the list of the meds. We enter that information into Medicare.gov, and they'll show us all 50. And one of the slides will show the lowest price 10. In this particular case, and I'm not trying to sell Tufts or anything. But it showed the lowest price plan for this hypothetical person with these hypothetical physicians and hypothetical prescriptions. Tufts came out on top. It had a 0 premium for the health and drug coverage. That doesn't include the Part B cost. And this hypothetical person's prescriptions averaged, or not average, came out to cost about $800 a year. Or what's that, 65, 70 bucks a month? And it showed there's a deductible for the drugs, but it's just about all of us know drugs come in tiers. Tiers 1, 2, 3, 4, 5. Tier 1 is generics, the lowest cost. Tier 2 is specified generics, and after that, it goes to tiers 3, 4, and 5. And in most of these plans, whatever the drug deductible is, it doesn't apply to tier 1 and tier 2s. So then I take a printout of the exact benefits in a particular plan. And in this case, the husband's meds cost $814. The wife's meds were 0. I think she had, we showed like 3 tier 1s, maybe 1 tier 2. But all of these plans are specific to the individual. So when somebody says, well, what's the right plan for me? I don't know. Let's figure out, what doctors you use, what meds you're taking, how healthy you are. Are you going to live here forever? Are you going to move somewhere else? These plans will cover you anywhere in the country for urgent care or emergency care. Some of them that will apply in the world. So, but it's, it's different strokes for different folks. What fits you? So now what happens if all your physicians are not in a network? So what I do is I provide a spreadsheet for people. And 1, 2, 3, 4, 5, 6, 7. I did 7 insurers trying to find out if the person's physicians were in network. In this case, none of them were all in the network, but Tufts seemed to be the best because this guy didn't care about his pain doctor. He could use anybody. And the wife had most of her docs are in the plan. So what it then boils down to, nobody wants to have to leave their doctors. I get it. So you get up tomorrow morning, you read the paper, or you see it online, your favorite physician was killed in a car crash last night. Are you going to stop seeing doctors? No, you're going to get a replacement. So what fits you the best? Or in this case, if you've got to leave an existing physician, what fits you the least worst? So, but all of this information you got is needed in order for you to reach an informed decision. And that's, where we come in to try to help you get all the information that's germane to your situation. Now, we just got through this stuff in the fall. It's annual election period where you can change your Medicare Advantage or Part D plans. It ran from October 15th to December 7th, and the coverage begins on January 1st. Excuse me. The commercials were nonstop. In fact, I did a I did a workshop at a retirement community, independent living community. There were about 55 or 60 people there. So I was trying to figure out how to relate to them. So I'm leaning up against the wall, and finally the person that put the event together said, Russ, I think everybody's in here now. And there were 55 or 60 people. So I said, has anybody seen any Medicare commercials on television lately? They all started laughing. I said, would you buy a used car from Joe Namath? And if you wouldn't, why would you talk to him about Medicare? Now, they've come up with a new one 2 years ago, and we're into it now. Let's say you, Broadway Joe or Captain Kirk or JJ or somebody talked you into a plan that you thought was the greatest thing since sliced bread. And then after you got the details and you checked it out, you didn't like it. Well, they have a Medicare Advantage open enrollment period that runs from January through March, where you can switch to a different plan or go back to original Medicare plus a drug plan. Ooh, Medigap. This is what I have. The plan I have has all doctors and hospitals in the country that accept Medicare. You need a separate drug plan. Original Medicare pays first. The insurer pays second. You need that other drug plan. The bills work this way. The provider bills Medicare. Medicare pays its share and then sends the balance to the insurance company. This is what it looked like for me. The bottom piece of this, I just copied off a benefit statement I received from Medicare. And Medicare tells me for this particular claim, they paid $110. And then they sent the balance to the insurance company. So that's how Medigap works. What's the best Medigap plan? In Massachusetts, it's Medicare Supplement 1A. It's called Plan G in other states. Different underwriting applies. So what's the best? Well, what's the same with all of them? All plans are standardized by Medicare, the coverage. Original Medicare has 6 gaps. These plans pay five out of the 6, and you pay a 233-year deductible. Doesn't that work? It's only provided it accepts Medicare. There's customer service. Whoever picks up the phone. All these plans are identical. They're standardized. There's no difference between any of the insurance companies. Pricing might be a little different. So it's customer service. All right. You call the 800 number, you're talking to somebody on the other end of the line. They're having a great day. They get up on the right side of the bed. Everything is perfect. They are happy campers. They give you a great experience. So 15 minutes later, you say, oh, I forgot to ask this question. So you call the 800 number back, and the person that picks up the phone is having a bad day. It's going to be a nightmare. But this happens everywhere. So, I'm trying to point out that all these companies are the same. Claims experience, 99% of the problems come from a billing error. So we got 3 basic options. What we talked about. Original Medicare, then Medicare Advantage, Medicare Supplement. Now, my wife is disgustingly healthy. She sees her PCP twice a year for essentially a wellness visit and takes no meds. I've had some health challenges, so I pay a lot more for a Medigap plan and a drug plan. Her plan is Medicare Part C versus what I have, limited network versus national, deductible, smaller deductible. Copays, no copays, referrals required, no referrals, low cost, higher cost. So I call her plan pay as you go. It's got deductibles and copays in it. So my decision is, if I need a couple of carotid ultrasounds a year, maybe a couple of echo EKGs and other testing, I say, is it conceivable I might spend $200 on deductibles and copays if I had her plan? And if the answer is yes, it's $200 a month there, I'm going to prepay it over here. So we're looking at pay as you go versus prepaid. That's the difference. Both plans are going to have drug copays, which fits you the best, and you can change plans in the fall. So does it make sense to switch to an employer health plan or from one? That's your decision. Your employer cannot bribe you, threaten you, incent you, or otherwise to get you to leave the health plan to go to Medicare. So if you want to think about doing this, talk to me and I'll give you the comparison. So our choices are this Medicare and You book. This is what your mailbox looks like in the fall. Now you can talk to Joe Namath, but we got a better choice for you here. This old guy over here on the right. So here's what one happy camper had to say. We're also part of an elder care network, like many of you folks on this call are. And if somebody's got a question on another part of the elder care puzzle, we all know someone we can refer them to. Oops. These are the slides we'll send you. And I think Marianne sent out an email with a PDP for these particular slides here, which is a good review for what we covered here.
I did. I already sent them out, but I understand that some other folks did register after I was already on, and I just will have to look at the new people, which I'll get everybody, and I'll resend out the handout, so no problem.
All right. And the last slide is about me, is how to get in touch with me if you want to give me a shout. And
Perfect. Well, put your slide back up, I would say, just for your contact information, Russ.
Yep.
And while people are maybe copying down your name and your number, there was a question. I saw Tufts regarding Part C. They said as a 5-star, you can change plans anytime. Do not have to wait until the open enrollment. Is that correct?
you can do that, and this year there's only one 5-star. And since I'm not, this is not a marketing program, I'm not going to say it's Tufts,
Okay.
but that can be done. You can only do it one time during the year.
But if you are a 5-star, you could change anytime.
Anytime during the year, but only once during the year.
All right, so I do have another. If you are keeping the same plan year to year, do you need to re-enroll or is it automatic?
It's automatic, but come the fall time, if you've had any changes in your health, and the plan you presently have doesn't seem to be adequate, or now you've got expensive medications you should take another peek at it in the fall to make sure you've got what fits you the best going forward.
We've got one that I actually had mentioned when we first got on the call. If someone's turning 65 in March, if they have an FEHB health insurance plan, would it be beneficial to suspend the plan and go on an Advantage plan? Do the Advantage plans have a monthly premium?
It all depends on what their existing plan is. I'm guessing FEHB might be federal employees health plan.
Health benefit, yeah. maybe.
So what we'd have to do in a situation like that would be to sit down with that person, have them bring a copy of that plan. So, a summary of the benefits. And then compare those benefits as to what might be available through one of the Medicare plans. And also, how much are they paying? How much is the employer kicking in for the premium? Because now when they could essentially get a Medicare Advantage plan for just their Part B premium if they get a zero premium. But let's compare the benefits to that plan to that which they have. They don't want to end up with less coverage, but we've got to know the specifics of the plan that they presently have.
Right. Somebody's asking about dental coverage. It seems like not everyone offers dental coverage.
Well, the dental coverage you get as a senior is not going to be as good as what you've been used to. Most dental plans offer 3 levels of coverage. Basic coverage, which is cleanings and x-rays. Then the next level is the cleanings and x-rays are usually 100%. Then the restorative stuff, like its fillings and so forth, are payable at 80%, and then the expensive stuff is payable at 50%. Now, having sold these plans for years and years to groups, I always considered dental insurance to be the worst kind of insurance available. And the reason why I said that is, if you've got a house worth $500,000, would you pay $250,000 a year to insure it? And everybody would say, absolutely not. Well, I say, well, that's how dental insurance works. The maximum payout you're going to get is probably, depending on the size of your employer, is $1,000 or $1,200 or $1,500 a year benefit. And if it's costing you $50, you're paying $600 in each year in premium to get $1,000 benefit. If you need coverage, I mean, you got to go with it. But otherwise, put that $600 in a shoebox under your bed. And if you don't have any expenses, the next year you've got another $600 that you'd put in. So now you got $1,200. So you're essentially self-insured. However, if you're employed and the employer is paying 75% of the premium, then it might be a good deal. And some of these plans offer dental insurance. They'll pay 50% of your claim up to $1,000. But all the plans are different, and you got variables on top of variables, which can drive you crazy. But I can answer dental plans. I can explain the differences of which are better, which are worse. Some companies are now starting to give you a debit card to pay for dental, vision, hearing, or a health club to the tune of either $500 or $1,000 a year. And that's another piece of the puzzle that can either confuse or unconfuse people. But it's a matter of staying on top of it and, finding the plan that best fits your circumstances.
Russ, I've got a couple more questions and I know we normally end at 1:15, so I want to make sure I do the raffle just to keep everybody on time.
All right.
One person is asking where your office is, for one.
I have offices everywhere. You might think they're Panera Bread.
Actually, you did tell me that before.
Yeah. No.
Nice. So if somebody calls you, you'd be open to meeting with them.
Absolutely.
Perfect.
Individuals or groups that want a presentation or whatever, anything to unconfuse people about this Medicare stuff.
Perfect. I have another question. Is there any time when pre-existing conditions are a concern of changing plans?
Not in Massachusetts. Massachusetts is a guaranteed issue state.
Okay. What if you're like, say like Connecticut?
Connecticut, well, for Medicare Advantage plans, that's not a big problem, but the challenge is if you have a Medigap plan in another state. In other words, you can get a guaranteed issue within 6 months of your Part B effective date. If you try to go into a Medigap plan after that, you're subject to underwriting, which means they could decline to cover you because of your health, or they can jack the premium up, and they have both smoker and non-smoker rates.
Okay.
So, but these Medicare Advantage, I'm sorry, the Medicare supplement plans, Medigap, if you've got a Medigap plan you purchased in Massachusetts and you move to another state like Florida, you can keep that plan and you'll pay the Massachusetts premiums and you won't have to worry about anything, and you won't have to change to a plan when you're down there. The same plan will work for you anywhere in the country.
Okay. I've got one more, it looks like. I'm 65, working on wife's insurance plan. So does he need to wait to sign? Does he need to sign up now or wait until the husband retires? So husband and wife, he's 65, working on wife's plan. Does he need to still sign up now for part A or wait until he retires?
He can wait. One thing you might want to do is is it costing her to have him on her plan versus what it would cost for him to have an individual Medicare plan.
Okay.
And it all depends on how much the employer is subsidizing the premium. I mean, I typically now it's a 50-50 split. I ran into one group just before the holidays where the employer was paying 90%. And I told them that qualifies you as a dinosaur. But everyone's different, every company's different. And, you got to drill down to the bare bones to find out what the real deal is and what makes sense for the individual.
Right. It does seem it's a lot of information, Russ, and we really appreciate you giving us the information. I think that we're at 1:15. So if anybody has any further questions, if you wanted to email me, I could get them to Russ or go directly to Russ. He's got his number and his email right on the screen. Please feel free. I would like to actually look at next month. So save the date for next month, Wednesday, February 16th. Will be Unclutter Your Life and Love Your Space Again with Carlene E. Fisher-Hoffman, which should be a great presentation. Again, it is Wednesday, February 16th, 12 noon again. And I also would like to, well, everybody is still on, or I think we lost a few people, but let me just, I've got, hold on. Okay, Mark Maciolik. Let me see if he's still here. So I see his name. Mark, are you still on? Mark?
I'm here. Can you hear me?
I can. Okay, perfect. You have won the $25 gift card to Randall's Farm.
My
So,
lucky day. I live in Ludlow. That's perfect.
oh, perfect. So maybe what I could do is arrange to either meet you or I can pop it in the mail. So if you want to just shoot me an email and let me know your preference, that would be great.
I'd love to. I'd love to come to your site and maybe catch up outside or whatever you're comfortable with. So thank you very much. I'll email you after the presentation. And Russ, thank you. It was a wonderful presentation. Thank you.
Thank you.
Excellent. Thank you, everybody, for coming. So now at least I've done the raffle. Does anybody else have any other questions? I really appreciate everybody coming. I really appreciate you being here. What was that? Did somebody have a question? No, I think we are good. Somebody did ask for if we get the participants' names, because it's both professionals and community members. I don't share the registration list, but if you wanted to share anything, I will actually get you the chat. So if you wanted to be able to share your information in the chat, I could share that, but I can't exactly share the registration list because some personal folks are on it. Also, I will include the slides again that Russ had sent out, including his contact information for everybody, just so they have it. But I really appreciate everybody being on the call. I hope you have a great afternoon and enjoy the rest of your January, and we should see you next month in February. So again, thank you kindly very much, everybody. I enjoyed seeing everybody's little faces. Bye, everybody. Take care.